Now, live with Greg Olsen, Director of the New York State Office for the Aging.
Well, good afternoon, everybody. My name is Greg Olsen, and I'm the Director of the New York State Office for Aging. Really excited about our program today. Many of you may not know, but you will by the end, that this week is Falls Prevention Week, and that's going to be the topic of our conversation. Really important time to share critical information that can improve somebody's quality of life, their independence, their confidence, and most importantly, avoid injury, hospitalizations, broken bones, and potentially those types of injuries that can end somebody's life. We have a lot of supports to talk about. We like to provide not only information, but action-oriented things that you guys can do to not only assess your own risk, but to improve your overall physical health, to try to reduce injuries and falls in general. So falls are the second leading cause of unintentional injury deaths worldwide, and adults over the age of 60 suffer the greatest number of fatal falls. Falls are very serious, and they're extraordinarily costly. So just let me give you a couple of statistics really that bear this out. Out of every 10 falls result in an injury that causes an older adult to restrict their activities for a day or more, or seek attention from the healthcare system. Each year, about 3 million emergency department visits are due to falls for people who are older. Each year, there are about 1 million fall-related hospitalizations among older adults. And in 2019, 83% of hip fractures and hip fracture deaths and 88% of emergency department visits and hospitalizations for hip fractures were caused by falls. There's a lot more information. And, if you're like me, already know somebody who has fallen or certainly is at risk of falls. And that's what we're going to talk about today. There are a variety of risk factors associated with, making it something that somebody could fall, like lower body weakness, vitamin D deficiency, difficulties walking, use of certain medications, and so on. So I have an outstanding panel that is going to join me today, who are really experts not only in falls and fall injury prevention, but also ways to again increase strength and do the types of things that we can do at home in the community to try to really impact this important issue. So joining me today are Christina Akey, Aidan Jones, and Brittany Gambini. Christina has over 23 years of experience as a health educator. She currently serves in this role at the Bureau of Occupational Health and Injury Prevention at the New York State Department of Health. Christina, welcome.
Thank you for having us.
Aidan is credentialed as a master trainer in the Matter of Balance program, which is evidence-based. She's a conscious dying coach and a healthy aging program consultant and advocate. She serves as the lead regional coordinator and consultant for New York's older adult fall prevention program. Aidan, welcome.
Thank you. Thanks for having us.
Of course. And last but not least, Brittany is the falls prevention coordinator at SUNY Stony Brook Southampton Hospital. Brittany, welcome as well.
Thank you, Greg.
So before we dive into the meat of this, as always, we're going to take a quick break. Before we get into this discussion, we're going to take a break to look at, before we enter into Falls Month, the time where you might be having outreach, et cetera, from more charities and other organizations that are holding fundraisers. We know that older adults get scammed out of $29 billion a year, and charity scams are one of those scams. So let's take a look at this.
Have you seen an ad asking for a donation? How about a phone call or an email asking for a donation? We all want to help others, and that's really important. But what's equally as important is to protect yourself from people trying to exploit your goodwill through scams. Hi, my name is Greg Olsen, and I'm the Director of the New York State Office for Aging.
And I'm Dan Lyon of the Scam Fraud Identity Theft Prevention Program at Lifespan of Greater Rochester. Do your homework prior to giving money to an organization you know little about. Is it reputable? Go to the ftc.gov, charitynavigator.org, or charitywatch.org. You can learn things such as how much of your contribution goes to the administration of the organization and how much actually goes to the stated need.
or simply donate locally to a known not-for-profit organization. If someone reaches out asking for money or personal information, always remember, close the link, hang up the phone, and contact a trusted source instead.
Scammers are smart. Be smarter. And if you've lost money, please call 911 and report to your local police.
Visit our website at the New York State Office for Aging social media for more resources to become scam smart and learn the steps you can take to recover from a scam. Scams and financial exploitation cost older adults across this country almost $28 billion a year. Don't be one of them.
I want to thank Dan, Justin, Anne-Marie Cook, Lifespan of Greater Rochester have just been fantastic friends and allies of ours to try to combat this issue and for all that they do. So thank you. And check out the entire video series. We cover a variety of scams, romance scams, delivery scams, and so on and so forth. So take a look at that and protect yourself. So let's get back to today's topic, fall prevention. And remember, if you have a question for any of our guests, you can put them in the live stream chat and we'll address them at the end of the program. So Aiden, let me start with you. Why is it important to talk about falls and certainly injuries as a result of falls?
Absolutely, yeah. So every day in New York, we have 3 older adults, at least minimum, that are dying of fall injury. And we know that over 300 every day are going for emergency services. And we know that there's a significant cost in terms of quality of life and also in terms of healthcare dollars. In New York State, we are spending over $1 billion a year on treating people that are entering the emergency room. And then there's over $145 million of costs with people that are having outpatient services related to fall injury. And the part of this that we need to really talk about is that we know that many falls it's not a normal part of aging, and that most falls could be prevented if we were only talking about it and having those conversations. People want to preserve their independence. They're just kind of not sure how. And sometimes they're kind of afraid to talk about it because, will my children or my healthcare provider think I can't be independent anymore? And so we wanted to have this conversation, kind of take away that stigma so that we can find out what's going on. And, it's a multifaceted issue. It's not like a one size fits all solution for people who are at risk for falls, and we need to have the conversation to figure out how we can reduce their risk. And so that's why it's super important to talk about this.
Yeah, and I remember seeing years ago data from the health department on the age groups and falls, and for almost every age group, falls and injuries as a result of falls are primary. Where, and the public may not know this, where do most falls occur?
In the home?
In the home. Right.
Mostly in the bathroom at home.
Yep.
In the bathroom.
And it can be a dangerous place. I was, with one of the commissioners yesterday who had her arm in a sling, had some face abrasions, and I asked her what happened, and she fell bringing groceries into her home. The same thing happened to my mom. Christina, what are some common myths that people should know about falling?
Sure. We just mentioned the home being the place where most falls occur. And so folks typically think as long as they stay home, they're going to avoid falling. And that is not the case, because over half of all falls do occur in the home. Another common myth is falling happens to other people, not me. 1 out of every 4 older adults sustains a fall each year. Another myth would be falling is something normal that happens as you age. That is not true. Falling is not a part of aging. Another myth, muscle strength and flexibility cannot be regained. In actuality, we do lose muscle mass as we age. However, by incorporating exercise into your life, you can partially restore strength and flexibility. It is never too late to start an exercise program. Another myth, I do not need to get my vision checked each year. Vision is also another key factor for falls. People who have vision problems are twice as likely to fall. Please get your eyes checked each year.
Yeah, and I really like what you said about muscle mass and that it can be improved. We had a local gym owner who has a gym in Valatia and I believe Cohoes, who specializes in strength training for older adults, and had a bunch of them really talk about what it's meant for them. They had a woman that came in that couldn't bend because her knees hurt, and now she's on the national powerlifting circuit as an older adult. So again, to your point, there are things that can be done. Pets in the house, they're absolutely a hazard. I know that because I have 2 of them, and as I'm getting older, things like having a grab bar in my shower, which came with the house that I bought. I can't tell you, how many times I've had to use it because of how slippery it is. Brittany, what are some of the ways that falling can happen?
Absolutely. So when we talk about a fall, we're referring to coming to rest on the ground. And I think it's important to realize that there are varying levels of ways that people can fall. It can depend on your age, your physical and fitness levels. So for example, someone who may be a more fit older adult may fall while they're outside gardening, whereas somebody who may be a little bit frailer and not as active may fall while trying to get on and off the toilet. So some of the really common ways that we see people end up falling is when they're transferring from one surface to another. So that might be getting on and off the toilet, getting in and out of a bed or a chair, and getting in and out of the shower or bathtub. Another thing is when people are reaching for an object or carrying objects. So reaching out of their base of support, they lose their balance and topple over, or carrying things uneven on one side or the other. Another big thing is environmental hazards. So for lighting, not having handles or grab bars, or clutter, which then results in them falling. A really big one that I hear is people who are rushing or not paying attention. And then they say, oh, it was just a stupid fall. It just happened one time. But that one time is a good precursor to say, okay, well, now I need to implement something because this fall has already happened, even if we think it's just a silly, stupid fall. And just a few other ways are if people are not using their devices appropriately. So that can be something like a walker or a cane. If you were recommended by a healthcare provider to use those devices, they're really important to help decrease your risk of falling. And then things like not wearing appropriate shoes or walking on uneven surfaces are the biggest things that we typically hear.
Yeah, and I think all of those things are really important, but the low-hanging fruit for anybody that's watching this, whether you're an older adult, you're married to somebody, you are taking care of somebody, or it's a grandparent, are those things in the home. You talked about lighting, making sure the lighting's good. Throw rugs, right? It should be taped down, decluttering as much as possible to try to prevent those. Those are no-cost, very simple solutions. Risk factors, though, there's a bunch of other risk factors as well. And I think that those are critically important. I mentioned a couple of them in the beginning, but I'm sure that there's others you guys would like to talk about. What can increase the risk of falling, and who is at higher risk?
So the important thing to realize too is that the more risk factors that are present means the greater our risk of falling. So one is that having a fear of falling actually can create a higher risk of falling because it creates a negative feedback cycle. So what we hear is somebody saying they have a fear of falling, which then leads to them restricting their activities because they think they're keeping themselves safer, but that then results in increased weakness and impaired balance, which then increases their risk of falling and ultimately a fall. And it's really important to realize that you do not have to have fallen in order to have a fear of falling. That fear of falling alone can increase our risk of falling. Also, having a history of falls. So falling once actually doubles your chances of falling again. So that's why I said earlier, once that initial fall happens, we want to start intervening right away. And then just in general, having strength and balance impairments will increase our risk of falling, as well as having impaired hearing and vision. A lot of people think about the vision aspect, but they don't realize that actually impaired hearing can increase your risk of falling as well. And then chronic conditions that, a lot of older adults and the general population have, whether it's arthritis, a stroke, Parkinson's, dementia. And I think an important thing to note from that is that while those conditions can increase our risk of falling, we can work with our healthcare providers to manage those health conditions to try and decrease that risk. So an example is if you know you have diabetes, managing the diabetes with your healthcare provider to try to avoid developing neuropathy in our feet, which will then increase our risk of falling even more. And then in regards to who is at a higher risk of falling, the research actually shows that in regards to gender, that females actually have a higher incidence of falls. And for anybody who is interested, you can actually take a falls-free checkup, which will help you assess your falls risk. And you can take that information then to your healthcare provider to initiate those discussions about your specific risks for falls. And you'll see there's a link on the screen right now that you can use that or the QR code to take you directly to the page to assess your risk.
Yeah, and Alex, I'm going to ask you to keep that up for a couple of seconds because I think it's really important, both of those. It doesn't take long to fill this out, but to Brittany's point, it's great to be able to do a self-assessment and then talk to your family or your physician or others on what that data shows. And, I think that's really important. Aiden, we've talked about falls, talked about some of the risks, so on and so forth. What's the danger? Why is falling dangerous for older adults?
Yeah, this is the number one reason that older adults are losing their independence. I've had 2 of my 4 grandparents whose ultimate demise was a result of falls. And so a couple of things that are important to know. Yes, use your assistive devices, but make sure that you're getting them fitted from a physical therapist or an occupational therapist is working with you on that, because we don't want them to become more of a hazard than a help. So something just off the shelf at CVS may not be enough to address your specific issues. People are not talking to their healthcare provider. Sometimes they're embarrassed to talk with their family, even though the family's really afraid. But if you start having the conversation and we can figure out and get to the bottom of it, it may actually preserve your independence. So what seems like, it might be the dangerous thing is actually something that's going to be helpful. But the reason it's dangerous is they're losing their independence because of this. And it's the leading cause of injury death for most older adults. It's a huge problem.
Yeah, and the other danger, and I think you both talked about it, is if you have a fear of falling or you've fallen before, you limit your activities. When you limit your activities, you atrophy in a way, but you also isolate yourself. And we know what the impact of loneliness and isolation is, both on mental health with depression, but also on your physical health, equivalent to smoking almost a pack of cigarettes a day. Costs Medicare over $7 billion to treat. So there's a ripple effect for all of this. And I liked what you said about the equipment. For those out there who are using a walker, for example, we have right here an animatronic bird that goes on your walker so that when you get up, if you go without the walker, the bird will start chirping to remind you, hey, take your walker with you. So that you can, again, avoid a fall or an injury related to fall by walking away from your walker. So we have those available to folks that are watching. If they want to reach out to us, we can send them. They're very effective. What are some of the things that people can do to prevent? Again, I think we are so reactive as a society. We wait for something to happen and then we treat it or we deal with it post. But what can we do at the front end on the prevention side, which is where I think we all want to be, to prevent falls and the serious injuries and or deaths that result from them?
Yes. So when we talk about things we can do to prevent the falls, we look at what we call modifiable risk factors. So they're the risk factors that we can actually change and address. So we spoke a little bit about those environmental risk factors, making sure we have adequate lighting, making sure that the space around you is not cluttered, making sure your stairs are safe, whether that means a chairlift, having a ramp installed, handrails, whatever is the best situation for you, and removing throw rugs. Also thinking about your clothing. So sometimes making sure your pants are not too long that you might slip on them or that they're too restrictive and that you have proper footwear. So nice, sturdy, secure shoes on your feet. And we spoke a little bit about our vision and our hearing. So making sure that we're wearing the appropriate eyewear or hearing aids and following up with those yearly exams. And if you notice any changes in your vision or hearing, to follow up sooner, not waiting. We spoke a little bit about using the ambulatory devices, so a walker or a cane, and really making sure that not only are we using them, but we're using them appropriately. And following up with your healthcare provider if you're not exactly clear on what the most appropriate use of that device is for you. Another big one is medication review. So whether with your healthcare provider or your pharmacist, really understanding what medications you're taking, the side effects of those medications, and that if you are experiencing any side effects, to speak with your healthcare provider. Don't stop taking any medications without having those discussions, but really initiating those discussions if you are experiencing any side effects. And speaking with your healthcare provider if you do note any changes in your strength and balance. So one of the best things that we can do is to stay active to help us improve our balance and strength. And if you need to speak with the healthcare providers, that you can start addressing that before it becomes an issue. And really advocating for ourselves as we age. If we're not, our family and friends may not realize that we are having some of these issues. So making sure that we bring up concerns with our family, our friends, our healthcare providers, so that we can get the help that we need. And you can start small. You don't have to try and do everything that we just listed at once, but we need to start somewhere. So I think that's the biggest thing, is just starting where you're able to start decreasing those risks.
Right. I think that's great advice. And, this week is Fall Prevention Week. However, this is a week that should be 52 weeks a year. And conversations do need to be had. And so, a lot of times in our own lives, and I can only point to myself, right? Things gradually change, and you may not notice that, but your family and friends and neighbors might. And as we're moving into the holiday season with Thanksgiving and Christmas, and, we've got other types of gatherings that are going to happen over the next couple of months. What are the kinds of conversations that families should be having? Because, if you haven't seen a grandparent, let's say, in a year, you might notice a change in gait, slower walking, balance issues. What would you recommend how to start a conversation about what we're talking about today?
Sure. For older adults, they must speak with their healthcare provider and be honest. They need to be clear and concise. They also need to do the self-assessment for the risk of fall risk, which has been shown on that QR code. Also, older adults need to ask for help when needed and not be afraid to ask for help. You must advocate for yourself if you're an older adult. And again, as Brittany had mentioned, the healthcare provider will be the first course of action. For family, friends, and caregivers, be supportive, lend a hand when you can, help to develop a plan to get the older adult moving, getting them into some sort of exercise program. Be supportive, and you must advocate for your loved ones in any way that you can.
I think we know that an ounce of prevention is worth a pound of cure. And so that's really where we're coming from, is if you have that proactive plan, you're going to know what to do. You're going to be empowered to take steps to keep yourself safer and more independent. And in terms of going into the holidays, Greg, we like to tell people, have 3 points of contact everywhere you go. Make sure there's 3 points of contact, and that way your chances of falling are much less as well.
Yeah, and I didn't plan on asking you guys this. You talked about a lot of the risk factors and things like that, but I was thinking of the holidays as you guys were talking. What's the impact of alcohol misuse in falls?
That's a good, that is certainly a risk factor. And that's actually one of the questions on this questionnaire is if you are partaking of that, that you are aware of it, and that that is going to increase your risk, especially through the holidays. What's really interesting is we think like winter time is going to be like, ice in New York is going to be a real issue. We see more fall injuries statistically in the spring after people have been inactive all winter long. And so that's something to be aware of too, as you're going through the winter, that don't let yourself slip into this place of being isolated, because we know social isolation is really bad for you. And we know that inactivity is really bad for you as well. And these are things that we address through some of our evidence-based programs in New York. Yeah,
that's a great point. And compounding the alcohol is the prescriptions that people are on, right? So that it increases it that much more. So you guys do this every single day and appreciate what you do. What is New York State as an entity doing for fall prevention?
Sure. We collaborate with our great partners. Aiden Jones here is our consultant. Brittany, along with all of the other partners at Stony Brook Medicine. We have our older adult fall prevention website, which Alex has shown. Aiden is our regional coordinator for the entire state. So located throughout New York, we have several regional coordinators that help get the information out to their communities and let folks know where programs are, or they will help someone find a program in their communities. We also have a new publication. It is listed on our website. It is Older Adults, Stay Steady, Stay Strong. These are free. You can order these through our distribution center on our publication page. We also can provide any information for anyone who is looking for any of the programs, and I can be contacted at injury@health.ny.gov. I can be emailed, and any information to get someone started. If you are at a loss and cannot find any information, please reach out.
And then I'm very happy to share that Stony Brook is actually a grant recipient for a federal grant through ACL, the Administration for Community Living. So what that means is that we have 4 evidence-based fall prevention programs that we're able to help with through our grant, and they're implemented in the community for older adults. So if you are interested in those, the Long Island Falls Free website, we post our programs on there. There's an email listserv that you can join so that you can be notified when there are new programs coming out. But that is one of the ways that we have multiple resources and webinars really trying to address all the things that we've spoken about today to give people actionable things they can do to prevent falls.
Yeah. And I would say that from the regional coordinator perspective, we're constantly working on getting programs out there. And so it's good to check with your local office on aging, because within your county, there's very likely some of these programs are being implemented through them and some of their partners. And we also are working on a virtual program network that is posted through Long Island Falls Free website, which is available not just in Long Island, but for older adults all over the state. And we are working on that virtual component so that people have access to these programs. They can go to senior centers in person, but we can also have other options for them where they can just log in from home, and that way they don't have to be worried about their caregiving responsibilities and such. They can do this right from home.
Yeah, I'm really glad to hear about that. We worked really hard with many of you guys on expanding a matter of balance throughout New York State. The pandemic on many of those in-person evidence-based programs significantly went down in terms of participation. And so having, in-person and virtual options, we know from some of our partnerships like Get Set Up that people are very comfortable doing these types of exercise programs and strength training in their home. So why not provide it, right? There's more than one tool in the toolbox. So I'll ask this question of any of you that would like to answer. If we didn't get to a question that you wanted me, what is one of the key messages each of you wants to share with the audience? And the audience is going to be organizations, healthcare, not-for-profits, older adults, younger individuals. So it's pretty broad-based. What message would you like to provide?
Sure. I would say keep moving for everybody.
I know, simple and effective, right?
Sure.
I would say that by making changes and acknowledging falls risk, it will actually help keep you independent. It won't take it away from you.
Yeah, absolutely. I think people need to remember too that it is those physical skills, but there's also a mental skills component, because people who are experiencing depression or isolation have a higher risk of fall injury as well. Their support network that's involved, know who your people are, know your risk, take our falls risk assessment and know where you stand, because if you know where you stand, gravity won't have as good of a chance as bringing you down, right? Keep those 3 points of contact and stay steady.
That's great. I love it. All 3. Before we get to the Q&A, we're going to take a break. We have been talking extensively over the last year about the Medicare Savings Program, MSP, which will put upwards of $7,000 into the Social Security checks of eligible older adults. As of today, we have almost 1 million people that have signed up for MSP that have put almost $7 billion back into their pockets. One of the governors huge platforms is on affordability. So can you imagine if you are eligible for MSP around $2,300 a month and the SNAP program, which is similar, that you could increase your income by $10,000 a year just from those two programs. Let's take a look at this.
The Medicare Savings Program, or MSP, could save you up to $7,000 annually. Hi, I'm Heather Leddick with New York's Health Insurance Information, Counseling, and Assistance Program, also known as HICAP here at the New York State Office for the Aging. New York State recently expanded the MSP to include higher income limits in 2023. What does this mean? You and approximately 300,000 other New Yorkers may be newly eligible for this assistance right now. If your income falls within the levels on your screen, please apply today. If your income is just above these numbers, still consider applying. You may be paying for out-of-pocket costs that can be deducted from your gross income to make you eligible. Free, objective, statewide assistance is also available to help you in the application process through HICAP. Simply call the statewide helpline at 1-800-701-0501.
Thanks, Heather. And one of the things Heather said that is critically important is objective. We're going to be going into open enrollment season for Medicare in the first week of November. And it is really important to reach out to somebody that's not selling you anything. And that's what our HICAP counselors do. It's going to be a lot of ads on television bombarding you with promises from plans on what they're going to deliver. Get the objective information you need. So let's take some questions from the audience today. And I think there's some great ones. Where can I find a good fall prevention program to join?
I would highly encourage people to visit the LongIslandFallsFree.com website, and you'll find virtual and in-person programming that's available there. And then, as Aidan mentioned, the offices for the aging as well as libraries all have different programs.
Alex, can you bring our guests back in? Thanks. I just don't like looking at myself. Yeah, that's right. And also, I think we're going to put the link up there for Get Set Up. So you got the local offices for the aging. There's other community groups that are doing, walking, exercise programs. It can be done in chairs. They can be done standing up. But we also have that's free for anybody over the age of 50 in New York State. And that's on our dime. If you go to that site or go to our website to find it, many of the offerings of the over 5,000 programs, et cetera, deal with exercise, strength training, et cetera. And that's something that we talked about earlier, a virtual option that can be done in the home. Next question, please. How should I address my concerns with my healthcare provider? I really like that question because people get very intimidated about bringing things up. And so we say, well, we should do this, we should do that. But I think it's more of like, what's the icebreaker?
Yeah, this one is if people are in doubt, then if they know what their risk score is, they can go to the doctor and see what those tangible risk factors are. And oftentimes it's something like, wow, I've noticed I have this balance issue. I need to ask my doctor for a physical therapy referral or a referral for that vision checkup or something along those lines. We also know that in programs like A Matter of Balance, you're having that conversation and you're doing that planning process. And so helping to get connected to those types of things as well is something possibly also from a healthcare provider perspective.
Anybody else have anything to add? I think taking that survey that we provided, that QR code, that's, as you were saying earlier, that's a great starting point because you have it.
And just to add to that, those results from that will be emailed directly to you so that you have something to actually bring to your doctor with you. You don't have to remember all of your answers.
Oh, that's great. All right, next question. What can I do today to reduce my risk of falling?
Take the survey there and know what your risk is. Yeah. And then start making that plan to address them. Get connected to a community resource, to a clinical resource, get connected. And we know that that's the way through this. We know that your risk factors are going to look very different than the person sitting next to you. And so as soon as you start that planning process and figuring out how to reduce your risk, the greater your chances of remaining independent and safe in your home will be.
Definitely go through your home, check the space around your home, where you're sitting, where you sleep, the bathroom. Make sure everything that Brittany had mentioned. There's a checklist. You can also see that on our older adult fall prevention webpage for New York State. And seek help from anybody who can help you if you think that you need to make accommodations in your home.
We're all here waiting. We're at the ready.
Well, that's good that we have a force ready. And again, those are, it's low hanging fruit, to look at the home, the environment, to take the survey, to talk to a physician, to get onto a virtual or an in-person, exercise program. You're never too old, I guess is the point. I love this question because this really concerns me. And I know, people in my family, they often don't know what medications they're taking, the dosages, there's, adverse drug interactions. What do people need to know about medications and fall risk? Because this is a big deal.
So with the medications, the more medications that you're on will increase your risk of falling alone. But I think to what you said, Greg, the biggest thing on my end is knowing what medications you're on and the side effects to be aware of, and making sure that you're taking the accurate medications, whether that means using a pill box with them, setting alarms in your phone so that you don't forget to take your medications. And then really paying attention to how you feel when you take your medications. If you're taking your blood pressure medication and then 45 minutes later, you always notice that you're getting a little bit lightheaded, bring that up to your doctor right away, because they might need to adjust the dosage that you're on, or some medications you have to eat food or you might feel lightheaded. So really just paying attention to those specifics of your medications and having those discussions, because your healthcare provider can adjust things as needed if they're affecting you in a negative way.
Yeah, and just to build on that, what we know according to the data is that 4 or more is what puts you at higher risk for a fall. Sometimes you really need to be on those though, but can you adjust the dose or the timing? We're getting better with the electronic health record systems of knowing when your specialist puts you on something, is the guy across town putting you on something else. That's getting cleared up in our healthcare system, I think. We don't see as much polypharmacy issue as we used to, but that's still something to look out for, because you want to know what type of interactions you're dealing with. Things like blood pressure medications in particular that almost all older adults are on are a huge culprit, because when that dosage is adjusted or when it's a new med, it can cause issues. Things like antidepressants, knowing what time of day is appropriate to take it. Those are all factors in medication management. And a pharmacist generally can do a review for you to see if there's any kinds of adjustments that could be made.
And I think always having your medication list on you, that lists the medication that you're taking, the dosage that you're taking, when during the day you're taking it, so that God forbid, if something does happen, you have those medications on you, as well as if you're at a provider's office, if they're setting you up with a new medication, you can make sure they're aware. Like Aiden said, the electronic medical records are getting better, but if you're going to a physician who's in an outside hospital system, they may not have your entire medication list. So I really, really think having an updated, accurate medication list on you at all times is really important.
Yeah, and if on the label it says don't take alcohol with this, abide by that, especially if you're on multiple medications, right?
Absolutely.
Or if it says do not drive while taking this medication, which also I'm going to get into the fall risk while someone is getting in and out of their vehicle. There are adaptive mechanisms that older adults or anyone can purchase to help get yourself in and out of the vehicle.
Yeah, so if we have a partnership to do car fit programs that do a lot of what you're talking about, or those adaptations you can make in the vehicle for not only driving safety but for getting in and out. So that's a great point.
Sure. I didn't know if I could plug the car fit, as I'm a tech.
You could plug anything you want. You saw me plug the Walker Squawker, right? There it is, right there. Alex, do we have any more questions? Okay, doesn't appear like it is. Well, again, I cannot thank you enough, Christina, Aiden, Brittany. This is a really, really important topic. what bothers me about some of these topics sometimes is it's designated for 1 week, but these are 52 weeks a year type of issue. So I thank all three of you for joining me today, providing this really important information. There's a ton of resources, some of them a little bit more intense than others, but there are things that people can do. What was one of the questions? What can I do today? You guys answered that beautifully. These are they're things that people can do once they view this to start to improve themselves with exercise programs, looking at medication lists, taking the survey, getting the data back, talking to family, talking to friends, talking to your provider, et cetera, because what you don't want to be is one of those stats, right? We can't bury our heads in the sand and say, well, I hope this doesn't happen to me, but I did know somebody. These are the types of things that can end your independence, land you in a nursing home, or literally kill you. And so, we could take some really small steps forward to try to have an impact that's going to prevent those types of things from happening. And again, what I like about this is we're talking prevention, and prevention is critically important, not waiting for something bad to happen and then figuring that out. So again, I want to thank the three of you for joining us. Our next episode is going to be with Heather Leddick, because we're getting into the time where open enrollment is going to begin for Medicare. So we're going to learn more about that, how you can connect with an objective person. We'll probably touch upon MSP and applying for that and what the eligibility criteria is, and also the fact that you have to recertify every year, which is unfortunate, but that's what the rules are in order to maintain that benefit. So again, thank you all for joining us. As always, I want to thank Alex, Darren, and Roger from my communications team for making this as flawless as always. And I hope you guys have a great day, and we'll see you in 2 weeks. Take care.
Hey, be careful. You might think you're never going to fall, but we all know someone who has, don't we? Next time, it could be you. The good news is most falls are preventable. Start with 6 easy steps. First, find a balance or exercise program to help you build stability, strength, and flexibility. Make it fun and go with a friend. Don't be afraid to tell your doctor if you've had a fall or are afraid of falling. Ask her to assess your risk of falling. Discuss medications with your pharmacist or doctor. They'll know what prescriptions and over-the-counter medications can increase your risk of falling. Make sure you get your vision and hearing checked every year, because your eyes and ears are key to keeping you on your feet. Keep your home safe. For example, remove any items you might trip over. Make sure your home is well lit. Use bath mats in your shower and install grab bars in the bathroom. And finally, remember, it's important to talk to your family. Ask for their support in taking these simple steps to stay safe. Falls are not a normal part of aging.
Live with Greg is a production of the New York State Office for the Aging Communications Bureau. Please join us next time.